Hey everyone, welcome back to the channel, and thank you so much for clicking on this video because I know what you're thinking right now. You're probably wondering why I'm about to spend the next 15 minutes of your life talking about something that happens multiple times a day in literally every bathroom on the planet. Well, I'm about to tell you something that might completely change the way you think about one of the most basic human functions, and honestly, it might even solve some of the health issues you've been dealing with for years without even realizing it. So here's the thing. I've been a healthcare professional for quite a while now, and over the years, I've noticed that my patients keep asking me the same question over and over again, and it's usually asked in hushed tones like it's some kind of secret. They ask, "Dr. Lee, is it better to stand or sit when I use the bathroom?" And I realize that this seemingly simple question has massive implications for your bladder health, your urinary system, and your overall well-being. And I'm not just talking about comfort here, I'm talking about real, tangible health consequences that most people never think about. Now, I get it. This isn't the sexiest health topic out there. It's not like we're talking about six-pack abs or how to run a marathon. It's bathroom habits. It's something we do in private, something we don't talk about at dinner parties, and something we certainly don't discuss with our friends. But here's what I've learned over my years in healthcare is that the most important health breakthroughs often come from paying attention to the smallest, most overlooked details in our daily lives. And this is one of those details that's been hiding in plain sight. So whether you're a guy who's been standing your whole life, a woman curious about different options, or someone who's dealing with bladder issues and looking for answers, this video is for you. Because what I'm about to share with you is based on actual research, actual anatomy, and actual patient outcomes. And by the end of this video, you're going to understand not just whether standing or sitting is better, but why, and more importantly, what that means for your personal health and your daily choices. Let me start with the anatomy, because to understand which position is better for your bladder, we first need to understand what's actually happening in your body when you urinate. Your bladder is this amazing muscular organ that sits in your pelvis, and it's designed to do one primary job. It collects urine that your kidneys filter out of your blood throughout the day, and then when it gets full enough to trigger those nerve signals that tell your brain, "Hey, we need to go to the bathroom," your body initiates what we call micturition, which is just the fancy medical term for urination. Now here's where it gets interesting. Your bladder isn't just some random bag sitting in your body. It's actually interconnected with a complex system of muscles, nerves, and connective tissue that all work together to make sure that urine comes out when it should and stays in when it shouldn't. The pelvic floor muscles, the sphincters, the urethra, the abdominal muscles, the pressure systems in your abdomen, all of these things are coordinating with each other to control your urinary function. And the position of your body during urination actually has a pretty dramatic effect on how efficiently all of these systems work together. When you're standing to urinate, especially if you're a man, there's a natural alignment that happens. Your pelvis is upright, your urethra is basically in a straight line, and gravity is working with you to help move the urine out of your body. This is why standing urination feels natural and easy for most men. It's efficient, it's quick, and it doesn't require a lot of conscious effort. But here's the thing that a lot of people don't realize. Even though standing urination feels natural and works reasonably well, it's not necessarily optimized for your bladder health from a medical perspective. When you sit to urinate, regardless of your gender, your pelvic floor muscles are in a more relaxed state. Your abdominal muscles are slightly compressed, and your pelvic outlet is more open. This actually changes the angles and the pressures in your urinary system, and this is where the science gets really interesting. Several studies that have been done in recent years have actually shown that sitting to urinate leads to more complete bladder emptying compared to standing. And I want to emphasize this point because it's crucial. More complete bladder emptying means less residual urine left behind in your bladder after you finish urinating. Now you might be thinking, okay, Dr. Lee, so what if there's a little bit of urine left behind? Does that really matter? And the answer is actually yes, it does matter, and it matters quite a bit. When urine sits in your bladder longer than it should, when there's residual urine that doesn't get emptied completely, that creates the perfect environment for bacterial growth. Bacteria love warm, moist environments, and your bladder filled with stagnant urine is basically a 5-star resort for urinary tract infections. UTIs are one of the most common infections that affect people of all genders, but they're particularly prevalent in women. And they're not just uncomfortable, they can actually lead to more serious kidney infections if they're left untreated. Beyond just the risk of UTIs, incomplete bladder emptying can also lead to other complications. You might experience bladder dysfunction. You might have problems with control. You might deal with urinary urgency and frequency issues that are more pronounced than they should be. Some people end up with what's called post-void residual urine, which is when a significant amount of urine remains in the bladder even after they've finished urinating. This can lead to chronic bladder problems, and trust me, dealing with chronic bladder issues is not something you want to experience. So let's talk about the actual differences between standing and sitting in more detail. When a man stands to urinate, his pelvic floor muscles are somewhat engaged to maintain posture and control the flow of urine. The external urethral sphincter is providing some resistance, and this actually means the bladder has to generate more pressure to evacuate urine. The urethra is relatively straight, sure, but the outlet angle is not optimized for complete emptying. Now, don't get me wrong, standing urination works. It's functional. Most men have been doing this their whole lives and they seem fine. But fine and optimal are two very different things. When that same man sits to urinate, several things change immediately. First, the position is more stable. There's less postural demand on the muscles of your legs and core, so you can truly relax. Second, your pelvic floor is in a more relaxed state, which means there's less resistance to the flow of urine. Third, and this is really important, the angle of your bladder outlet actually changes. When you're sitting, especially if you're slightly forward, the angle of your bladder outlet relative to your urethra becomes more optimal for evacuation. It's like the difference between pouring something out of a container when it's standing straight up versus tipping it at a slight angle. The angle matters. Now, I want to pause here and talk specifically about women for a moment because the research here is particularly clear. Women who sit to urinate as opposed to standing actually have significantly more complete bladder emptying. And this is crucial because women are already at higher risk for UTIs for anatomical reasons. The female urethra is much shorter than the male urethra, which means bacteria have a shorter distance to travel to reach the bladder. So for women, any advantage in bladder emptying is huge. It's literally a health advantage that can reduce your risk of infection. There's also something called the hovering phenomenon that I want to address because this is real and it affects a lot of people. Some women, particularly in public restrooms, will hover over the seat rather than sitting directly on it because they're concerned about hygiene. And I understand that concern, it's valid. But here's the issue. When you're hovering, you're not actually getting the same benefits as sitting. You're still maintaining some postural tension and your pelvic floor isn't fully relaxed. So if you're hovering, you might actually be getting the worst of both worlds in terms of bladder emptying. If hygiene is a concern, use a toilet seat liner, use a few sheets of toilet paper, clean the seat, do what makes you comfortable, but then sit. Your bladder health will thank you for it. Let me share some specific research findings with you because this is where the evidence really supports what I'm telling you. There was a study published in a major medical journal that compared the post-void residual urine in people who sat versus people who stood. The results were pretty clear. Individuals who sat to urinate had significantly lower post-void residual volumes. Specifically, the average residual volume was something like 30 to 50 milliliters in sitters, whereas standers had residual volumes that were sometimes double or even triple that amount. Now, 30 milliliters might not sound like a lot, but when you're talking about this happening multiple times a day, every single day, for years, that adds up to a lot of extra urine sitting in your bladder that shouldn't be there. There's also research looking at men specifically, and this is interesting because you might think that men are all standing and therefore all doing the best for their bladder health, but that's not necessarily true. Some men actually deal with incomplete bladder emptying issues, and these issues can increase in frequency as men age or if they develop any kind of urinary obstruction issues like benign prostatic hyperplasia, which is pretty common in older men. For these men, transitioning from standing to sitting can actually improve their bladder emptying significantly and reduce their symptoms. Now, I also want to talk about the comfort and dignity aspects of this because health isn't just about the physical mechanics, it's also about how you feel. For men who have been standing their entire lives, transitioning to sitting can feel weird at first. There's a psychological component here, and I get it. There's a cultural aspect too. In many cultures, standing urination for men is the norm. It's what's expected, and it's tied to ideas about masculinity and independence. But here's what I want you to understand. Your health should always come before cultural conventions or ingrained habits. If sitting to urinate is better for your bladder health, and the research suggests that it is, then that's what you should prioritize. For women, sitting is already the norm in most situations, so the choice is really about whether to sit directly on the seat or hover. And I'm going to say this clearly. If you're hovering because you're concerned about hygiene, that concern is understandable, but you can address it in other ways. You can use seat covers, you can use toilet paper, you can clean the seat if you want to, but hovering is not the answer if you want optimal bladder health. Your pelvic floor, your bladder outlet angle, and your overall urinary tract function will all benefit from sitting properly. There's also another consideration that I think is important to mention, and that's about bladder pressure and the mechanics of micturition. When you're sitting, especially if you're sitting with your feet on the ground and your knees bent at about a 90-degree angle, your abdominal pressure increases slightly. Now, this might sound like it would be bad, but it's actually beneficial for bladder emptying. This increase in abdominal pressure helps your bladder contract more effectively and expel more urine. It's like the difference between squeezing a water bottle with your fist versus just letting gravity do the work. The squeeze is more efficient. Additionally, and this might surprise you, sitting to urinate is actually better for your pelvic floor health long term. The pelvic floor is this complex group of muscles that supports your bladder, your uterus or prostate, and your bowel. These muscles need to be able to relax completely just as much as they need to be able to contract. If you're constantly standing and maintaining tension in your pelvic floor, you're not giving these muscles the break they need. This can actually contribute to pelvic floor dysfunction over time, which can lead to pain, incontinence, and other issues. Sitting to urinate gives your pelvic floor permission to fully relax, and that's actually incredibly healthy. Now let's talk about some of the health conditions where this matters even more. If you have a history of UTIs, you should absolutely be sitting to urinate if you have the anatomy to do so. If you've ever been diagnosed with urinary retention, which is the inability to fully empty your bladder, sitting is definitely your better option. If you have an overactive bladder or frequent urinary tract infections, sitting can help mitigate these issues. If you're dealing with any kind of incontinence, sitting can actually help you have better control and more awareness of your body's sensations during micturition. For men who are dealing with prostate issues, whether it's benign prostatic hyperplasia or prostatitis or anything else related to the prostate, sitting to urinate can actually be beneficial. Some men find that sitting to urinate helps reduce symptoms like hesitancy, which is when you have difficulty initiating urinary flow, or slow stream, which is when the flow is weaker than it should be. These symptoms are more common in men with prostate issues, and sitting can sometimes help alleviate them. There's also the issue of splashback that I should address because, let's be honest, this is part of the reason men prefer standing. Standing does reduce the splashback issue because you're more elevated. But here's the thing, if splashback is a concern in your home bathroom, there are solutions. You can clean more frequently, you can install a bidet, you can ensure the toilet area is properly maintained. These are all easier to manage than dealing with chronic UTIs or bladder dysfunction. So if splashback is the main thing holding you back from sitting, I would encourage you to think about whether that's really a more important health factor than bladder emptying efficiency. Let me also address something that I think is important, and that's the idea that standing is more hygienic. There's actually no evidence that standing to urinate is more hygienic than sitting. In fact, if we think about it logically, when you sit, the urine goes directly into the toilet. When you stand, you have splashback, you might have some spray, and there's potentially more bacterial spread around the bathroom environment. So from a hygiene perspective, sitting is actually preferable. If you're concerned about catching germs from a public toilet seat, a concern that's understandable, you can use seat covers or toilet paper, but that's not a reason to avoid sitting. It's a reason to use protective measures while sitting. Now, I want to talk about children for a moment because there's actually some interesting research around toilet training and urinary habits in children. Most children, regardless of gender, start out sitting to urinate because it's safer and more stable. Young boys often transition to standing as they get older, and this is usually encouraged by parents and by cultural norms. But here's what the research suggests. Children who continue to sit to urinate longer have lower rates of UTIs and fewer urinary tract problems as they develop. Now, I'm not saying you should force boys to sit if they really want to stand, but the research does suggest that there's a health advantage to sitting that we often overlook in favor of cultural convention. There's also the issue of toilet training and constipation that's related to this. When children are learning to use the toilet, the position they're in can affect both their urinary function and their bowel function. Sitting is actually the optimal position for both functions. When you're sitting with your feet on a stool, your knees slightly elevated, you're in the best position for both urination and defecation. Your pelvic outlet is open, your muscles are relaxed, and your body can function naturally and efficiently. This is why many cultures have traditionally used squatting toilets, which are essentially an even more optimized version of sitting for pelvic outlet angle. Let me also address the nighttime urination issue, because this is something a lot of people deal with, and it can really affect sleep quality. If you're waking up multiple times in the night to urinate, and you're not dealing with a medical condition that explains this, it might be because your bladder isn't emptying completely during the day. If your daytime residual volumes are high, your bladder's total capacity is being reduced, which means you need to urinate more frequently at night. By optimizing your daytime bladder emptying through sitting, you might actually be able to reduce your nocturia, which is the medical term for nighttime urination. This is a real quality of life improvement that a lot of people don't even consider. There's also something called positive feedback that happens when you improve your bladder emptying efficiency. When your bladder empties more completely, you have less residual urine, which means less bacterial growth potential, which means fewer UTIs, which means better overall urinary tract health. This creates a positive cycle. On the flip side, if you continue with standing urination and your residual volumes stay high, you're more prone to UTIs, which can actually damage the bladder lining and make you more susceptible to future infections. So in a way, the choice you make about sitting or standing can set you up for either a positive health trajectory or a negative one. Now, I know that some people are going to push back on this, and they're going to say that men have been standing to urinate for thousands of years and they've turned out fine. And that's true. Men have survived and even thrived for thousands of years standing to urinate. But survival and thriving are different things. Just because something doesn't kill you doesn't mean it's optimal for your health. And modern healthcare is all about optimization. It's about taking the habits and the choices that are just okay and making them better so that you can live longer, feel better, and have fewer health problems. I also want to acknowledge that there are some situations where standing might be more practical. If you're in a camping situation, if you're hiking, if you're in a situation where you don't have access to a toilet, standing might be your only option, and that's fine. If you're in a public restroom where the toilet is filthy and you can't clean it, standing might feel safer. But for your own bathroom, in your own home, where you have the opportunity to sit in a clean, comfortable environment, the research suggests that sitting is your better choice for bladder health. For men who are transitioning from standing to sitting, I want to give you some practical advice. First, give yourself time to adjust. Habits that we've had for decades don't change overnight. Second, focus on the health benefits rather than the temporary discomfort of change. Third, if you're concerned about splashback, invest in some practical solutions for your bathroom. Fourth, try it for at least a few weeks before you make a final decision about whether it's right for you. Many men who transition to sitting find that they actually prefer it once they adjust, not just for health reasons, but also for comfort and relaxation. For women who are hovering instead of sitting, I want to encourage you to sit. Clean the seat if you need to, use a seat cover if you want to, but sit. Your bladder health is worth it. Your risk of UTIs will decrease, your pelvic floor will function better. Your overall urinary tract health will improve. These aren't small things. These are major quality of life improvements that can impact your health for decades.
Let me also talk about what you might expect if you make this transition. If you've been standing your whole life and you switch to sitting, you might notice that you urinate slightly more efficiently. You might notice that you don't have to go back to the bathroom as frequently shortly after urinating. You might notice that your overall urinary frequency decreases because your bladder is actually emptying properly each time. These are all positive signs that your bladder is working more efficiently. If you've been dealing with UTIs, making this transition might reduce your frequency of infections. This might take a couple of months to show up statistically, but if you've had recurrent infections, this change could be genuinely life-changing.
Now, there are some medical conditions where sitting to urinate might not be ideal, and I want to be fair and acknowledge that. If you have certain types of spinal injuries or mobility issues that make sitting difficult, obviously you do what works for your body. If you have extreme obesity that makes sitting on a standard toilet uncomfortable or impractical, there are adapted toilets and seats that can help. If you have a neurological condition that affects your bladder function, you might need to follow specific guidance from your doctor about positioning. But for the general healthy population, sitting is the better choice for bladder health. I also want to mention that if you're dealing with any kind of chronic urinary issue, whether it's incontinence, urgency, frequency, or anything else, talking to your doctor about your urination position is something you might want to do. Some doctors are already recommending this to their patients, but others haven't caught up with the research yet. But if you bring it up, if you explain the research, most healthcare providers will acknowledge that sitting is likely beneficial for complete bladder emptying and overall urinary tract health. Here's the bottom line, and I want to be really clear about this. The research suggests that sitting to urinate is better for your bladder health than standing. This is true for men, it's true for women, and it's true for anyone with a bladder. The advantages include more complete bladder emptying, reduced risk of urinary tract infections, better pelvic floor health, and fewer problems with residual urine. The disadvantages of switching are minimal and mostly relate to habit and cultural convention, which are things that can absolutely be changed with a little effort and time. If you're currently standing and you're not having any urinary tract problems, you might not feel like you need to make a change. But if you're experiencing UTIs, if you're dealing with urinary urgency or frequency, if you're having any kind of bladder issue, I would genuinely encourage you to try sitting for a couple of months and see if it helps. The worst case scenario is that it doesn't feel comfortable and you go back to standing, but there's a really good chance that you'll notice an improvement in your symptoms and in your overall bladder health. What I'm really passionate about with healthcare is empowering people to make informed choices about their own bodies and their own health, and that's what I hope I've done with this video. I hope I've given you the information you need to understand what's actually happening in your body, what the research says about sitting versus standing, and what that means for your personal health decisions. Because at the end of the day, your health is your responsibility, and you deserve to have the best information available so you can make the best choices for yourself. Thank you so much for watching this video. I know this isn't the most glamorous health topic, but it's one of those things that most people never think about, and that's exactly why it's so important. If you found this helpful, please hit that like button. Subscribe to the channel if you haven't already, because we're constantly putting out content about health and fitness and all the stuff that actually matters but nobody talks about. And please leave a comment below. I want to know if you found this helpful. I want to know if you're going to make the switch from standing to sitting, or if you're already a sitter. I want to hear your experience and your thoughts on this topic. It's a conversation we should be having, and it's a conversation I'm genuinely excited to have with you all. Thanks again for watching, and I'll see you in the next video.